Hello world, and welcome to the first segment of Healthy Me, Healthy You on Non-Fil Flicks, your home for Black entertainment. This is Kitty Vittles coming to you from the good USA. Hey, with the finicky sensitivity to lay it all out for you. This is our first installment ever, and we're coming to you with a familiar yet tricky subject, coronavirus, aka COVID-19. We're going to discuss the numbers in the U.S. a little, the mutations, touch on the vaccines a little. Countries are scrambling a lot. But speaking of vaccines, why is AstraZeneca asking for millions of doses of their vaccine back from the White House? And what is the word from the White House on the subject? What is the COVID situation in Brazil? And which COVID vaccine is the common thread in a blood clotting issue? Child, stay with me to find out. COVID-19 news in the USA these days is all about vaccinations, as the daily infection rate seems to be hovering at around a little over 65,000 new infections per day, with approximately 12.4% of those infections being people who are of Black, non-Hispanic descent, according to the CDC. This is a noticeable decrease from January 11, 2021, when the infection rate for the day was 249,360 people. And of those cases, 14.7% were reported as being Black. So there have been at least 29 million total infection cases, and of those, 1.45 million of those cases were Black. Black or African American people were nearly 3 times more likely than non-Hispanic white people to be hospitalized, and almost twice as likely to die from COVID-19 infection. According to the CDC, there have been over 530,000 total deaths in the U.S., and of that number, Black people amount for 15% of COVID-19 deaths where the race is known. Beyond the main strain, there are 3 variants of SARS-CoV-2, the disease that causes COVID-19, that have been diagnosed and found to be in the U.S. They are B.1.1.7, first seen in the U.S. in December 2020 and identified in the United Kingdom January 2021, called the UK variant. This strain has a large number of mutations, though 2 have been prevalent, spread, and are currently reported to be in 70 countries around the world, most noticeably and separate in the UK and South Africa, respectively. This variant is so strong it can reinfect someone who has had and recovered from the original strain. Okay, so also in January 2021, scientists from the UK reported early evidence that suggests that the B.1.1.7 variant may be associated with an increased risk of death compared to the other variants. More studies are needed to confirm this finding. You will hear this phrase again from me quite a bit. Okay, so we've gotten a little educated. Now let's discuss some current events, shall we? According to BBC.com, there have been reports from health authorities in Denmark, Norway, and Iceland of blood clots in people who have taken the University of Oxford AstraZeneca COVID vaccine, which has halted its use in several countries, though regulators around the world continue to back its safety and use, while recommending that anaphylaxis and hypersensitivity should be listed as side effects on the vaccine's label, citing that, quote, the benefits outweigh the risk, end quote. It is less expensive and easier to store for longer periods of time. That includes Health Canada joining in agreement with the decision of the European Medicines Agency, EMA. The World Health Organization also has said there's no reason to stop using the vaccine, as BBC News reports. European officials and the company said there was no evidence of any causal link In the vast majority of cases, the onset of such medical conditions have nothing to do with the vaccine. Some percentage of people are expected to get sick by chance after getting vaccinated, as would happen in any group of people, end quote. All of these vaccines, in fact, most if not all of the COVID-19 vaccines that have reported data so far, fall into the reactogenic category apparently. They can cause a noticeable reaction, so be prepared just in case you feel a little ill for a day after being vaccinated, because this is a possibility. And now, eye-raising news out of Brazil via Reuters.com, where it's being reported that intensive care wards for treating COVID-19 patients have reached capacity levels of over 90% in 15 out of 27 state capitals, according to Biomedical Center Fiocruz. In Porto Alegre, in southern Brazil, the main reference hospital for COVID-19 stopped admitting new cases because all of its ICU beds were taken. There were patients on respirators crowding emergency rooms. Time.com is reporting that in a report by the Observatory, an international group, and Justica Global, a Brazilian group, separate issues, Brazil's indigenous communities are in danger due to the country's COVID-19 response failure. All fingers point to President Jair Bolsonaro's lack of cohesive and rigorous COVID-19 policy and other geographic and governmental challenges that threaten vulnerable communities like the indigenous populations. Quote, the budget of the National Indian Foundation, or FUNAI, the agency responsible for promoting and protecting the rights of indigenous peoples, was reduced by 90% shortly after Bolsonaro took office, says the report. Furthermore, despite the emergency situation, only 39% of federal funding to combat the pandemic among indigenous peoples was actually dispersed, end quote. How do you feel about that? I mean, The death toll from COVID surpassed 2,000 for the second time in a 24-hour period, with 2233 dead, and new infections rising by 75,412. With a death toll of 272,000, Brazil trails only the United States in COVID deaths around the world. Brazil and all of our brethren around the world, we here at Nonflix send our deepest, heartfelt condolences. In other news, according to NBCnews.com, the U.S. has tens of millions of Oxford AstraZeneca vaccine doses the world needs and is begging for with the help of AstraZeneca themselves. The unused vaccine doses are not in use due to a delay in its approval by the Food and Drug Administration, which is partly due to the company not applying for the licensure of approval in the U.S. due to miscommunications, and partly due to the clinical trial results not being back yet. The trials had to be stopped for 7 weeks last year due to the company being slow to provide the FDA with evidence that the vaccine had not caused serious neurological side effects in 2 of its volunteers. The company has said that it will, quote, seek guidance from the U.S. government on replacement doses for use in the U.S., end quote, said Gonzalo Vina, a spokesman for AstraZeneca. The company is suggesting that the U.S. give its unused doses to the U.K., where the company stumbled in its vaccine rollout. The White House is waiting for the trial results and emergency approval of the vaccine to dispense to the American people. Next, the White House announced plans last month to contribute up to $4 billion to a global COVID-19 vaccine program aimed at assisting developing countries, with the initial $2 billion going to a World Health Organization-backed program called COVAX that supports access to vaccines for 92 countries. The remaining $2 billion will be paid over the next 2 years, including an additional $500 million when other donors' pledges are fulfilled and initial doses are delivered. Finally, according to NBCnews.com, the U.S. agreed Friday to work with India, Japan, and Australia to get up to 1 billion doses to countries in Asia and the Indo-Pacific region by the end of 2022, said National Security Advisor Jake Sullivan. Well, guys, it's about that time. Time to share some opinions, time to get going, time to make a change in life. What do you think about that situation in Brazil? What do you think about that blood clotting situation with the vaccine? Got some information that you want to share, correction you want to make? Well, I love learning and I appreciate the truth, so please, by all means, drop a comment below and let's discuss it. Personally, I think that we should give Brazil every single vaccine that we are not personally using, but I'm afraid of sharing with them anything that's going to be adverse. I don't know. I'm torn. Anyway, until next time, wash your hands, wear your masks, be safe, and my name is Kitty Vittles over at Non-Fill Flicks, wishing you peace and health. Healthy me, healthy you. Until next time.